A world-renowned craniofacial surgeon has returned to Chattanooga several months ago.
Yesterday, Dr. Larry Sargent performed his first surgery at Erlanger in almost 5 years. He practiced in Chattanooga for decades before leaving for Utah 5 years ago. His patients are excited to have him back in town. Our Mary Frances Hoots has this story.
Well, Greg, Dr. Sargent performed surgery on a 14-year-old boy who has Apert Syndrome. Luke Harvey has had 31 surgeries in his lifetime already, and this was his 5th craniofacial surgery. They have all been performed by Dr. Larry Sargent. The family even traveled to Utah to have one done. They are beyond grateful Dr. Sargent is back in town, and they say he's given their son a chance at a normal life.
Sweet demeanor and a very sweet soul. Who has a great sense of humor.
Luke Harvey is a 14-year-old boy who goes to Whitwell Middle School. His mom, Heather, says he's your typical teenage boy who loves to pick on his siblings. However, he's had a rough way to go. He was born with Apert Syndrome,
a deformity that involves both the skull and the face. It's really a lack of growth of both these areas.
It requires reconstruction at different ages. Luke's first craniofacial surgery was at 10 months old. He's had several more since then, and Wednesday was his most recent one, all done by Dr. Larry Sargent.
He has really just given Luke a chance at what we call a normal life.
Wednesday's surgery was 7 hours long. It required a lot of planning and enhanced technology. Dr. Sargent was reconstructing Luke's forehead. To do that, he printed a 3D model of Luke's skull and compared it to a normal skull.
Design a particular custom implant like this and use it to reconstruct the brow or the forehead instead of taking all this bone off and moving it forward.
It was a very intricate procedure that not many doctors across the country are even capable of.
I have the experience now that very few people have in the country.
Luke responded well to the surgery, and his family is grateful to have Dr. Sargent in their lives.
He is his friend, and he truly wants to see Luke be successful and thrive in life.
Very rewarding to try to help these children. It's very challenging. They are very difficult cases.
And Luke sure is thankful for him.
He's nice.
Recovery will be about 4 to 6 weeks long. It will involve intense swelling of his forehead, and Luke's mom says he is doing a lot better today and was released from the hospital about an hour ago. Live in the studio, Mary Frances Hooch, Channel 3 Eyewitness News.